Time now for the Business Spotlight on the WMAY newsfeed. It's sponsored today by the SIU Center for Family Medicine. Dr. Christopher Smyre is a family practitioner and is here with us. And we're talking today about preventative checkups. This is so important because it's hard enough to get people to go to the doctor when they are in an acute situation where they really need it. But preventative checkups can make such a difference in avoiding much more serious outcomes. Doctor, I'm guessing, though, that it can be a bit of a struggle to get people to take that kind of preventive care.
I think it's about educating and empowering patients to understand that it's okay to see your primary care doctor, just to be able to say everything is going well, to ask the questions. I know with the pandemic, a lot of people have questions about vaccines. So having a visit where we can think about the future long-term health implications of our decisions now is a great way for keeping us healthy and safe.
How regularly should we get these sorts of preventive checkups? Is this something that should be done annually, more frequently than that? What's the best advice you can give?
I would say probably at least once a year having an annual checkup to go over sort of where you are, what can be done, what are the things that we need to be looking out for. And then depending on what are those things that we're sort of keeping an eye on and monitoring, they may be more frequent.
What sorts of things fall under the heading of preventive care? What would ordinarily happen in that sort of a visit?
So preventative care is going to vary based off of the age. So in children, these are typically going to be also called your well child visits, where you're talking with parents about sort of developmental milestones, what's appropriate, how to support them. And then as we get older in the adult ages, we start thinking about what types of cancer screening tests that we be doing, whether that's pap smears to screen for cervical cancer in women, mammograms to screen for breast cancer, or even colonoscopies and other tests to screen for colon cancer. So those preventative visits are going to be where we think about based off how you're living your life, whether you have a history of smoking, obesity, other risk factors, and family history. When should we start looking for things to prevent problems from getting bigger?
What sort of time should people block out for a visit like this? The typical checkup, is it done in an hour, less? Would it take maybe more than one visit if, as you said, you have to have lab work or other tests done?
Yeah, so it'll vary depending on how healthy or complicated a person's medical history is. But typically, I would say plan for probably 20 to 30 minutes for that preventative visit. It can sometimes be shorter if it's a doctor that you already have a rapport with and who already knows your history. But if it's first time, I would say 30 minutes with planning on a follow up visit to go over the lab results that are ordered from that first visit.
We probably all had the situation where we've gone to an emergency room thinking was something seriously wrong and then find out it's really actually nothing. You're actually okay. A little bit frustrating, a little bit embarrassing. With preventive checkups like this, how often do you find things that are really serious and need that sort of attention, or is it just as valuable to go in and say, yeah, actually you're in good shape right now, you're doing good?
Um, so you do often find, so the reason why we have the screening tests for cervical cancer, breast cancer, and colon cancer, and even lung cancer is because we know if we catch it early enough, there's a lot of interventions we can do to really adequately treat the cancer and have someone be able to live a fulfilling life. And so those visits are important, and we hope the test comes back negative. But if it does come back positive, we're thankful that we did it sooner rather than later so we can be more aggressive and prevent problems. And at the same time, for people who are otherwise healthy, it's really good to have that visit to think about not only how you're living, how to stay healthy, but also, and the reality is we're all going to come to a point where we have to think about end of life care, and being able to have that conversation when we're healthy without it being imminent is a great place to starting to think about what our values are and how to make sure those values are honored by our providers and the healthcare team that we go to for care.
Talking with Dr. Christopher Smyre of SIU Family Medicine. This is an area, too, where I think it's got to be so important for patients to advocate for themselves. If there's something that you think doesn't quite feel right or look right, or you've developed something that seems out of the ordinary to you, you've really got to be able to bring it up with your practitioner and make sure that you're communicating clearly about things that may be of concern to you.
Definitely. I think I am so relieved when I have my patients coming asking questions. And sometimes I don't have a good answer for it. Sometimes I'm not as concerned about it. But the fact that they brought it up and it's a concern to them makes it important to me to look into to make sure that we can all be reassured that this isn't anything to worry about. We can move forward. And there are times because patient knows their body's best about what they're experiencing and feeling that when they may say, hey, something's not right. And then when we do the test to look into it, we find out that they were right. There isn't something right. And now we can go about treating it.
You mentioned it's advisable to have these sorts of checkups at least annually. As people get older, should it happen more frequently? Is there sort of a threshold where you'd want to see this sort of evaluation more regularly?
It sort of depends. So as people get older, there tends to be sometimes more complications, more things that we're trying to weigh and make decisions about. So having more frequent contact can be necessary. But one of the benefits of being a family medicine doctor is that it's possible for me to be a doctor for a patient from when they were a little child to when they're old in age. And that having that longevity makes it easier to sort of know what their values are and how their values have evolved over time so that we can sort of continue to check in on an as needed basis, but at least once a year to make sure there's no big updates or no big changes to the plans and their goals of care.
So having that medical home, having that primary care physician that you can turn to have these regular checkups can be very valuable for your long-term health. Doctor, if people would like to reach out to schedule an appointment or find that sort of family practitioner for themselves, how do they contact you and the SIU Center for Family Medicine?
So they can go to siumed.org or they can give us a call at 217-545-8000.
Dr. Christopher Smyre joining us here in the Business Spotlight with the SIU Center for Family Medicine here on the newsfeed WMAY on 92.7, 94.7, and 970 AM.